This video was originally designed to be used in our clinic during an office visit. You may simply watch the video for general education, or if you plan to use this in preparation for an upcoming wellness exam, you may print out the handouts and checklists mentioned in the presentation. These are found in the patient education section on the website homepage. Please note, this video contains pictures of adult sexual anatomy used to explain cancer prevention health services. This may be too sensitive for younger children, and parental or caregiver discretion is advised. This video was produced on behalf of your healthcare providers at the Center for Family and Preventive Medicine. Dr. Henderson, Dr. Roach, and nurse practitioner Patricia Henderson. Among the most valuable healthcare benefits available to you are those that prevent or lessen the harm of serious disease. One of our important roles as your healthcare providers is to help you understand and take full advantage of these benefits. Thanks to advances in medical science, a number of serious and potentially life-threatening diseases can be prevented or at least diagnosed at an early stage. This can make the difference between a long and healthy life and a life that is needlessly shortened or burdened with disability. A simple test or procedure can often prevent a lengthy and costly hospitalization. In the case of cancer, preventive services may eliminate or reduce the need for chemotherapy, radiation, or surgery. An added benefit is to lessen the financial burden you may have with a serious illness. As your primary healthcare providers, we strongly recommend that you take advantage of the best healthcare available today by putting preventive medicine at the top of your healthcare priorities. The remainder of this video will present information on the major preventive services that we encourage you to consider. These are tailored to your age and gender. This information will be updated at least annually to ensure it is correct for your age and based on the best scientific information available. Therefore, we shall ask you to review this periodically in conjunction with one of your office visits. The topics covered today will be screening for colon and prostate cancer, the influenza or flu vaccine, and we'll also cover screening for depression and tobacco use, and we'll also touch on the important subject of advance directives. Your medical assistant will provide you with a handout that will give you important additional information on preventive matters not covered in this video. This includes immunizations not provided in this clinic, injury prevention, nutrition, exercise, substance abuse, safe sex, dental health, skin health, and CPR training. The bottom line for colon cancer screening is that early detection equals increased survival. The colon is a large structure in the lower abdomen and is a common site for cancer in men over 50. The key to survival with colon cancer is early detection. When the cancer is discovered early and localized to the colon, the 5-year survival is 90%. If the cancer is allowed time to spread, the survival may drop to 10%. This picture shows the stages of cancer. The red arrow on the top left points to a picture of cancer at an early or localized stage when the survival rate is very high. This is the same picture, and the red arrow at the bottom right points to a picture of colon cancer at the advanced stages when the outcome is very poor. So what are the best methods to detect colon cancer at an early stage? The most thorough method is to have a specialist insert a scope into the colon. There is a long scope used to do a colonoscopy and a shorter scope used to perform a sigmoidoscopy. They both can detect cancer and can even detect precancerous polyps that can be removed before turning into cancer. The main concern with this exam is that there is a small risk of injury to the colon during the exam, which can be serious. You must be willing to accept this risk to get the benefits of the most thorough method of screening. Another method is an X-ray known as a barium enema. Barium is inserted into the colon and allows a radiologist to look for signs of cancer or polyps. If problems are found, the scoping procedure is then done for biopsy or polyp removal. The third method for colon cancer screening are stool cards. Colon cancers often link blood into the intestine, and this can be detected in stool specimens that are collected and applied to a card. The exam using the long scope is performed every 10 years if no problems are detected. The shorter scope exam is done every 5 years. The barium enema is also repeated every 5 years. Stool card testing should be done every year. We also recommend doing a stool card test on the years in between having a scope test as added insurance. Future possibilities for colon cancer screening include advanced imaging such as virtual colonoscopy and DNA testing, but these are not in common use at this time. Prostate cancer is a leading cause of death in American men. Although there is an effective screening blood test for prostate cancer known as the PSA, there is a controversy over the use of this test. I shall attempt to summarize the positions of both the opponents and the advocates of PSA testing. Those that oppose the testing point out the fact that PSA testing does not distinguish between an aggressive type of prostate cancer that leads to premature death and another type of prostate cancer that is very slow growing and does not appear to cause premature death in some men. Opponents claim that many men with a slow-growing prostate tumor are receiving treatment that is known to produce complications such as impotence and loss of urine control. They argue that for these men the cure is worse than the disease. On the other side of the argument is the fact that for those men who have the more aggressive type of prostate cancer, early detection can be life-saving and allow treatment that may be less radical than if the cancer is discovered in later stages. This side argues that men should have the opportunity to know that if they have prostate cancer and then make the decision on whether or not to go ahead with treatment after discussion with their healthcare provider. Unfortunately, this is an area of preventive medicine without a black and white answer. Each man must weigh the risk and benefits of PSA testing and make the most informed decision for himself. Understanding that there is the above controversy regarding how fast or slow prostate cancer progresses in different men, the general accepted facts are that the 5-year survival for prostate cancer found in the earliest stages is as high as 99%. The survival rate drops to 33% when cancer has spread to distant parts of the body. This shows the stages of prostate cancer. The red arrow at the upper right shows prostate cancer at the early or localized state. In the same picture, the arrow at the lower right shows cancer in advanced state of spread. The best test to detect prostate cancer in an early stage is the PSA blood test. If you do decide to screen for prostate cancer, this test should be done once a year, along with a physical examination of the prostate gland by your healthcare provider. This is the end of Part 1 for male preventive services ages 50 to 64. Please now go to Part 2 to see the remainder of the recommendations.